Everyone, my name is Casey Hag, and today I'm going to do a physical exam on my dog Dina. Dina is a 4-year-old spayed lab Aussie mix canine. I'll start my exam with a distance exam, so this will help me decide what her temperament is, if she is happy or nervous to see me, if she's maybe anxious or scared. I'll also take a look at her gait, see if I can notice any abnormalities. Dina does have history of surgery on her left stifle for a luxating patella and a torn cruciate. That was about a year ago. You can notice some lameness when she runs, but when she just walks around, you wouldn't notice anything. So we'll see if we can get her to walk around a little bit. Good girl. Come here. Yeah, good girl. Good girl. Come here. Sit. Come here. Sit. Good girl. So I'll start my exam at her nose, and I'll go all the way to her tail, looking at all of her body systems. Use treats to motivate her. All right, Dina, come here. Sit. Good girl. All right, so I'll start by looking at her nose. It is moist and cool, which is normal, and there are not any foreign objects in there. Follow that up with an eye exam. So just looking at her, her pupils are symmetrical. There's no ocular discharge, and both irises are symmetrical as well. Sclera and cornea look good. Third eyelid looks good. Yep, third eyelid looks good. No foreign objects. And no inflammation noted. I will use this light to check her pupillary light reflex. This light is not very bright, but I did see a minor contraction of that pupil as it's supposed to be. Check her menace. It's appropriate. Menace is appropriate. If I had a brighter light, I'd be able to check her dazzle reflex and see if she blinked when I shined a bright light in her eye. Good girl. So eye exam is normal. Also, I should note that her eyelids and eyelashes are normal as well. I'll go into an ear exam. So Dina does have history of food and environmental allergies, so it's not uncommon for her to have redness and grease buildup in her ears. So I do notice some mild redness and some mild grease buildup in her right ear. Left ear looks really good, no grease in there, and only mild redness. Good job. I'll move into I should also look at her pinnas. Pinnas look very good. Good girl. Now I'll go into an oral exam. I'll start by just looking at her teeth. Look good. She does have some mild tartar buildup, so I would give her a grade 2 dental disease. I'm going to open her mouth. Good girl. I'm going to look under the tongue. Yeah, no masses. Look in the back of the mouth. No masses, no inflammation, which is good. Good girl. Yeah, good girl. And I'll take some time right now to look at her lymph nodes, her submandibular lymph nodes. Good. Feel like grape-sized, and they're symmetrical. Look at her prescapular lymph nodes. Girl, they're both symmetrical and appropriately sized, not enlarged. I've gotten a chance to look at her integument, her coat. It's got a good coat coat. Good girl. It's nice and soft, and there's no dandruff or redness. I've also gotten a chance to kind of feel over her body and determine a body condition score. I'd give her a 5 out of 9. She could be a little, she could definitely be healthy for her to be a little bit more, a little less heavy just because of her history of knee surgery. But I can feel her ribs, but I can't see them from a distance. So I'd give her a 5 out of 9. Next, I will move into assessing her hydration. So I also forgot to check her CRT when I was up in her mouth. So her CRT is less than 2 seconds, and her mucous membranes are moist and pink. So they're very normal. Good girl, Dina. Just by doing a skin tent, it returns to normal almost immediately. So she is hydrated, and that's confirmed with her moist mucous membranes. Good girl. Next, I'll go through her front limbs and just flex and extend all of her joints. You ready, Tina Bear? Good girl. Her shoulder joint is good. No pain and no crepitus. She thinks this is weird, so she's resisting me a little bit, but no pain and no crepitus. Good girl. Just going through each joint individually. Good girl. Each toe. Good girl. There's no issues. I'm going to look at her foot pads and in between her toes. Like I said, she has food and environmental allergies, so she does lick her feet pretty often. The dorsal part looks very good, but the palmar portion is a little red, and there is some hair missing from her allergies, but she does not appear to have a secondary infection. Good girl. And then I will check the other limb. Good girl. Doing my best to make sure she is comfortable, but that I'm also only moving one joint at a time. Good girl. Yeah, good girl. All joints are healthy from physical exam standpoint. No crepitus and no pain. I do want to look in between her toes again. Same as the other side, they are a little red on the palmar portion, but there doesn't appear to be a secondary bacterial infection. Just seems to be due to her food allergies. Next, I will move into auscultating her heart and lungs. I'm going to start by listening to the trachea. Sounds good. Doesn't sound like there's any narrow airways, or the trachea doesn't narrow. I'm going to listen to her heart on the left side first. I'm listening in multiple places to try to listen to each of the valves. So I'll listen on her right side to try to hear the atrioventricular valve. I can tell she has a sinus arrhythmia, which is normal, and there are no murmurs, so her heart appears healthy. Listen to her lungs. I'm listening to both dorsal and ventral lung fields for sounds of wheezes or crackles. Hers sound normal, just sounds like a light breeze. So her breathing sounds are appropriate. I'll try to get a heart rate, and I will also match it to her femoral pulse. Oops, sorry. Okay, stand up. Good girl. Stay put, right there. Feel a good, strong femoral pulse. It's matched by the heartbeat I hear when I auscultate. After listening for 15 seconds, I got a count of 20 beats, so she has a heart rate of about 80 beats per minute right now. I'm gonna just watch her diaphragm or watch her sides to get a respiratory rate. After watching for 15 seconds, I got a count of 5 breaths, so she has a respiratory rate of about 20 beats per minute. Both her heart rate and her breathing rate are normal. Next, I will move into an abdominal exam. Place one of my arms between her legs and then the other on the outside, and just lightly let her organs kind of slip through my fingers as I come down and coddle. We did go outside before this, so I cannot feel much of a bladder. I can feel a few loops of intestine, but I can tell that there are no masses and no inflammation, which is good. Next, I will go through her rear limbs, flex and extend them, and just see if there's any pain or crepitation on palpation. So, lean backward. Lay down. Good girl. So this is her left leg. This is the one that she had surgery on. When you compare each of her the muscles in her rear legs when she's standing, you can definitely tell that this left leg has less muscle on it. But she has made a lot of improvement since last year when she did have the surgery. So we're just kind of going slow and steady and building muscle as we can. So I'm going to start by assessing her hip joint. Good girl. Good girl. Good girl. Okay. I think she would rather have belly rubs than have me doing this exam, but no crepitation or popping heard on palpation. So I'm gonna do her stifle joint. It's okay. There's some mild crepitus in this joint, which is likely due to the osteoarthritis that had already developed by the time we figured out that she had a luxating patella and had surgery done. So I don't want to do too much more over there. I know she's a little uncomfortable right now. And then her hock joint is good. Check her toes. And the metacarpophalangeal or metacarpophalangeal joints as well. Those all look good. I'll look in between her toes. Ooh, that looks pretty red. She's been licking her feet for sure. Good girl. It's okay, Dina Bear. So she's definitely been licking her feet on that side, but it doesn't appear to be infected. We have her on side of point, so I think we'll just continue with the side of point for now. I'm gonna have her get up and lay on the other side to look at her other leg. Come here. Come here. Up, up. Lay down. Lay down. Good girl. There you go. Lay down. Good girl. Check her hip joint to start. She's a little resistant because it's a weird feeling, but no crepitus or pain. She's not whimpering. Check this stifle joint. You can tell that she's much more comfortable with me touching this one. There's not nearly as much arthritis, so can't feel any crepitation on this side. This side's much better. Check that hock joint. It's good. The metacarpo-interphalangeal feels pretty good, and then the metacarpophalangeal, and then now the interphalangeal joints. Those all feel good. It's pretty red there too, so she's been licking these feet a little bit. It is allergy season, so I'm not surprised, but it doesn't, there's no discharge to it, so she's doing okay. Good girl. We also have her on a hydrolyzed protein diet so that we limit her food protein, so we do as much as we can for her allergies. Good girl. I'll take a minute to look at underneath her tail, check her vulva and her anus. They both look really good. She does not lick or scoot her anus, so it's looking really good back there. If I had a thermometer, I would check her temperature, but I've looked everywhere and I cannot find a doggy thermometer. But I would just use some lube and insert it in her anus. A normal temperature would be 100 to 102.5, and I expect that her temperature would be normal because she's not been displaying any signs of infection. Okay, have you stand up again, Dina Bear? Up, 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 up. Good girl. I'm gonna check her popliteal lymph nodes. About pea size, they're both the same size, so they are not enlarged, and they are symmetrical. Good girl. All right, and that completes my physical exam. Sit. So I did a nose to tail exam, and the abnormalities I found were some mild tartar buildup on her teeth, some mild redness, and grease in one of her ears, some crepitus and discomfort when flexing her stifle joint, and some redness on some of her toes from licking and her allergies. Another thing I realized I should look at is her tummy. I did get a chance to look at it, but I didn't talk about it. Just want to look at it, especially with her being an allergy dog, and just kind of see if there's any pustules or papules or any infections. It does not often lick her tummy, so her tummy is good. And I think that completes my physical exam. Thanks for listening.